Hello, everyone, and welcome to this research report launch event. My name is Ahmed Baghdadi. I'm a research manager at WISE, and WISE is an initiative of Qatar Foundation for Education, Science, and Community Development. This event is organized in partnership with the Wellbeing Project and Duke University Center for Health Policy and Inequalities Research. The report we're launching today is based on a collaborative research effort by the Wellbeing Project and Duke University, as well as WISE. We did this to understand what promotes and what hinders teacher well-being in our school systems. The research was conducted last year, and the findings were presented in the 2021 WISE Summit in Doha in December, just a couple of months ago. Today, we would like to share with you all the findings of this report and discuss how we can sustain and promote the well-being of teachers in schools. I think many of us have either taught in schools, led schools, or supported schools in some capacity. Before the pandemic, very little attention was given to the well-being of teachers, even though they worked very hard. They worked under stress throughout the year. But when most schools turned to remote learning about 2 years ago, the situation got even worse for teachers who found themselves having to learn how to use technology, how to engage students who are not in the classroom physically, how to develop materials and create activities that fit this new format of teaching and learning, and keeping those students motivated, all while trying to take care of their families and staying sane themselves. Students also and their parents suffered, from all the restrictions that were in place. Some are still in place. So the increasing stress on teachers and the persistent challenges that they deal with on a daily basis are leading many of them to unfortunately leave the profession. And this comes at a time when the world constantly needs more teachers in our schools. I'd like to thank our partners, the Wellbeing Project team and Duke University for their collaboration in this effort. I would like to thank also members of the Caregivers and Teachers Wellbeing Group that was convened to guide this research effort for over a year. Some of the group members are joining us today and speaking in the panel later. The agenda for today, if we can share the slide for the agenda. We will start with a keynote speech for about 10 minutes, and then we will have the research presentation, where we also have questions and answers. And then for the second hour, we will have a panel discussion in which panelists will share their expertise, perspectives, and views on the well-being of teachers. And we also have, a part where we have questions. So we'll be using the chat function for questions and answers. Feel free to type in your questions throughout the time. We'll be monitoring the chat. We'll be, curating the questions and collecting questions in groups and sending them over to speakers when it's time for questions and answers. Without further ado, I would like to welcome our keynote speaker, Dr. Jennifer Adams, to set the stage for today's event. Jennifer has recently completed an 8-year term as the Director of Education for the Ottawa-Carleton District School Board in Ontario, Canada, serving a diverse student population of 73,000 students across 150 elementary and secondary schools. She's a former superintendent of curriculum, elementary school principal, and French teacher. She earned her doctorate in education administration from the University of Toronto in Canada. And she has served as a chair of the informal advisory group for the OECD study on social and emotional skills, and is currently on the executive committee for Karanga. And Karanga is the Global Alliance for Social Emotional Learning and Life Skills. She's also the chair of the Board of Governors at the University of Ottawa, and she's the editor-in-chief of the Knowledge Hook Signature Leadership Series. Jennifer is a founder and CEO of Educating Leaders, a consulting company specializing in education, future skills, and senior leadership and talent management. Jennifer, over to you.
Thanks so much, Ahmed, and thrilled to be here with all of you. And what I have to share just walking into the discussion today is my perspective as a practitioner. We have very esteemed colleagues from Duke University and the Wellbeing Project and Qatar Foundation who will be talking about research around teacher well-being. And these are just a few of my observations. As Ahmed mentioned, my background is a superintendent in a large school district in Canada, as an executive member, committee member for Karanga, and the work that I'm doing right now with Knowledge Hook Signature Leadership. So I'll share with you a few of my observations. We'll kind of look at a little bit around Ontario and what it looks like to create a system approach. We'll talk about the connection between well-being and SEL. I'll share a few great resources that are guiding some of my thinking right now. And finally, I'll end with just a couple of words on some advice to school and system leaders. One of the things that I wanted to share with you is the idea, and I know many countries and many jurisdictions are doing this, but for well-being of teachers to take place, we really have to think about a system approach to well-being. And way back in 2014, the ministry in Ontario went out with a large consultation. And out of that, they came up with 4 priorities. And you'll notice that the third priority was the idea of promoting well-being. And that had come from, there had been a change in the legislation in the Education Act that dated back to 2009, where the Education Act was revised to say that school boards and school districts were not only responsible for student learning, but for student well-being as well. So you could see there was this shift to a complete focus on learning to looking at more of a broader sense, learning, well-being, and having those pieces together. In the school district that I was in, we went out for a consultation as well. And I'll share this to you very quickly. We went out and we asked teachers, we asked parents, we asked business people, we asked our post-secondary, what are the characteristics and skills that all of our students, regardless of the program that they were in, what are the kinds of characteristics that they should have? And you'll see that these characteristics and skills are very closely related to well-being. What was interesting when we came out with this in our school districts and said to our teachers, kindergarten all the way to grade 12, we want you infusing your programs with the idea that the goal is to be developing children and young adults that have these characteristics and skills. They came back to us and they said, we need support. We need support from the district so that we as adults, as teachers, as educators can be continuing to develop these characteristics and skills. When I talk about well-being and it being a system approach, one of the things that you'll see in our school districts is you'll see lots of links for supporting mental health and well-being, particularly through the pandemic. So supports that students can access, teachers can access, parents can access. And we have an organization that is actually very much working on the idea of supporting schools to create a whole school approach to well-being. We know that if there's a whole school approach, teachers themselves will have a better chance of having strong well-being. And one last thing that I'll share with you, speaking to a superintendent in a district right now, you can see the evolution that this is getting to the point where they're really building policies even at the district level. And this is an example of a committee that was struck with the union leadership, the teacher union leadership, and all of the different employee groups. And they came up with a logic model that's entitled Wellness in Action, Committed, Connected, and Collaborative. So it's this idea that all of the members within this school district are coming together and saying we have to think not only about individual well-being, but actually organizational well-being. And I won't read through the different aspects of it, but you can see that they have come together to talk about things like life-work balance, recognition, valuing and respecting each other's. All of those pieces are the kinds of things that will come to actual system, a system approach to well-being. Second thing I'm going to talk about is an organization that both Dominic Register and I and many of others on the line probably are connected to. It's a global organization called Kadanga, and we are the Global Alliance for Social Emotional Learning and Well-Being. We took a look at the connection between SEL and well-being globally, and I won't walk through all of the pieces, but mental health is a very important aspect of connecting SEL and well-being. And we talk about how can we promote well-being to reduce mental health challenges. And of course, we think that social emotional learning is an important part of that. And we're not the only ones. When we look at recent OECD survey of social and emotional skills, the results came out in October. I'm sure many of you have seen this report. It's really one of the first international studies of social and emotional skills. I was very excited to be part of that. It was 11 cities from 10 countries around the world. Ottawa was one of the cities that participated. And it took a look at 10-year-olds and 15-year-olds and how they felt about their developing social and emotional skills, as well as how their teachers thought that they were developing and their parents. And what I will quote to you here, and you've got the link to this first report that the OECD has put out with their findings, but social emotional skills are definitely related to well-being. So they see the correlation. And when we think of that, a theme that I want us to be thinking about is when we're thinking of social emotional learning and well-being for our children, we have to be thinking about that for our teachers and our adults that are in there, that are helping in their care. I'm going to just highlight a few wonderful resources. I am learning, and I know all of you are learning from really good people that are doing work in the area of well-being, teacher well-being, student well-being. And what I think is really exciting is we have a combination of different sectors that are influencing us. We have people like Dr. Mark Brackett, who is from the Yale Center for Emotional Intelligence. And he is, of course, from the healthcare system, from the healthcare sector, the psychology, psychiatrist background. And he has a wonderful book out called Permission to Feel. And it really talks about giving students, giving children, giving adults, giving teachers the permission to be able to feel all of their emotions. They're very normal, and particularly in times of pandemic and war-torn countries that we're certainly seeing today, it's a really important piece. I love this piece around what we call the mood meter, and I've seen this used in schools in Canada often now, where a principal starting a meeting with their teachers will do a quick little warm up and say, oh, okay, everybody, mood meter, let's take a look at how we're feeling. And people have an opportunity to start that professional learning experience with a sense of, I'm connecting to me so that then I can connect with others. Another resource that I've been thrilled with, and Pasi Sahlberg, who many of you know, of course, a world-renowned academic from Finland, working in Australia and Sydney right now. He's just written a book, In Teachers We Trust. And I've given you the little link here to a podcast that I've just done with him and some of the others. You can access them on any of the major platforms. He does really interesting work, this concept of the reason why Finnish schools have the reputation of being places of well-being is because they respect their teachers and they have relationships, and they really put a focus on the community trusting teachers. And that's a very significant piece about teacher well-being. Joanne Mckechn, who's a wonderful colleague of ours coming from New Zealand, did work out of Australia. She has a really interesting concept. And again, had an opportunity to talk to her about her book, which is kind of written like a graphic novel. It's interesting, but it's the concept of contributive learning. And this idea that if we have children that are using their academic and their social skills to be able to go out and contribute in the world, they will have a higher sense of well-being. And the exact same thing is happening with teachers in schools, where they're working in schools, they get an opportunity, the teachers get reconnected to this idea of contributive learning, and they have a higher sense of well-being. Last one that I'll share with you is Dr. Alma Harris, originally out of UCL, but now working back in Wales. And of course, she did amazing work on the concept of distributed leadership, and again, a resource there. I'm going to end off with something that I always ask of when I'm doing my Knowledge Hook Signature Leadership Series, either podcasts or centers. We talk about, do you have any good advice for system and school leaders? And I'd summarize things by, you need to be thinking of 5 different things. Relationships. Pasi talked about that, and we really need to be thinking about, how do we make sure that teachers feel well valued and respected and have an opportunity to interconnect? Working conditions, my teacher unions would never forgive me if I didn't say, working conditions count. We need to be making sure that teachers feel safe in their work, that they're fairly compensated, etc. Leadership, we need to be thinking about empathetic leaders that can share the leadership opportunities within their schools and their systems. Professional learning, the idea of making sure that teachers can get together and work together and have that incredible sense of being on a common mission. And finally, policy. Policy matters. Systems that take the time to create vision statements around teacher well-being or well-being in general, priorities, policies, frameworks, all of those things count. Those are some of my observations as a practitioner, and I'm really excited to be able to hear from our colleagues at Duke University, the WISE Foundation, and the Wellbeing Project. Thanks so much.
Thank you so much, Jennifer. This is very insightful. Thank you. I really like the advice that you provide to the different categories, different groups of people, and I hope that we can implement, or each one of us can implement some of those in their own school systems or schools. It is now time for the research presentation, and I'd like to remind everyone to type your questions in the chat. We're looking at those, and we'll share the questions with the presenters towards the end of the research presentation. I'm pleased to introduce Dr. Regine Parshwold-Bell, a professor of global health at Duke University, Dr. Hee Nguyen, a community psychologist and researcher at the Center for Health Policy and Inequalities Research at Duke University, and Dr. Malik Mohammed Suhail, a lecturer of sociology at the Government College University, Faisalabad, to give us the presentation. Regine and team, please, the floor is yours.
Hello, everyone. I'm so pleased to be here with my team today to present to you on two studies that we've done on teacher well-being. And I just want to start off and say that it was a really large team that did this. These are just the team leaders, in fact, and our research was conducted across 3 different countries with more than 10 collaborators. And the collaborators came from 5 different countries. And so what you're hearing today was enriched by all of these people and perspectives. And today we're going to cover findings from 2 different studies. At the end, I'm going to bring together like what was different and similar about the studies and kind of what we learned from each and how they inform each other. So the first study was a scoping review of the teacher well-being literature. And so a scoping review is where you map out the body of literature on a certain topic area. It's generally less about specific findings and more about what research exists. And then the second study involved original data collection with 90 teachers, 16 principals, and 11 policymakers in 3 geographically and culturally diverse areas, being Cambodia, Kenya, and Qatar. I just want to point out, some of these findings that you hear today are going to be intuitive, but their strength is that we did this research systematically. We were inclusive of different diverse cultural contexts that are often underrepresented in teacher research. And the fact that we did this systematically tells us something a little bit different than anecdotes that you hear. Some of what we're going to tell you, you would hear in an anecdote. But here you can have confidence that it's actually representative of a far larger group of people. So now I'm going to turn this presentation over to Dr. Malik Mohammed Suhail to tell you about the scoping review, followed by Dr. Hee Nguyen to tell you about the case study findings, and then I will bring it together at the end.
Thank you, Professor Regine. In my presentation, I will focus on what we have learned from our scoping review. We conducted a scoping review and found 102 studies on teacher well-being. Of those studies, about half examined both teacher burnout and well-being, and about a quarter examined just well-being, and another quarter examined just burnout. It comes as no surprise that the majority of students' studies were conducted in high-income countries, with the most coming from the US, Italy, the Netherlands, Great Britain, and Australia. There were only 2 teacher well-being studies from lower-income countries, with just 1 conducted in Ghana and 1 in Uganda. 3 studies were conducted in Nigeria, which is a lower middle-income country. We truly need more teacher well-being research in lower-income countries. Next slide, please. So here are the major findings of our scoping review. We did a content analysis of the key findings of the 1 or 2 articles for both well-being and burnout. Positive workplace climate was a common recommendation. Across studies, teachers who had a calling orientation about work, they had better well-being. Those are the teachers who describe their work as integral to their lives and their identity. Such teachers believe that work is central to who they are as a person. We found that emotional management was equally important for well-being and burnout avoidance. Mindfulness-based practices surfaced from the literature as effective strategies associated with well-being and stress reduction. Teacher-student closeness predicted teachers' sense of self-efficacy and satisfaction, while negative teacher-student interaction like student misbehavior were associated with teachers' burnout. Lack of opportunities for professional development was also a significant factor behind teacher burnout. Next slide, please. Here are the things to do. Our scoping literature review findings suggest a list of things to do and things to avoid. I won't read through all of these, but I'll highlight a few. The role of emotions is very important. Inducing positive emotions and managing difficult emotions and stress, which mindfulness has been shown to help. Social support from principals and other teachers' colleagues is very important for teachers. When teachers experience professional autonomy, they can feel confident and they are more likely to consider different ideas in their work. Job crafting, which is when you find ways to maximize your time at work, doing what you most enjoy and find meaningful. That is very important for teacher well-being. One interesting thing that arose only in our scoping review is about humor. Positive humor can add positivity at work. Affiliative humor induces funny personal stories and jokes that enhance social interaction. Another type of humor is self-enhancing humor, which can help people deal with stress by seeing any possible funny side to a situation, even in a stressful situation. Let's now look at the next slide, which shows things to avoid. Overall, the literature suggested several things to avoid for better teacher well-being and burnout avoidance. Just a couple of key highlights. When teachers experience discrimination and subordination, it is really damaging and can cause a feeling of powerlessness among teachers. Same thing goes with bullying. Too much bureaucratization can affect teachers' performance because it hinders their professional autonomy. A perceived job insecurity among teachers can lower job satisfaction and organizational commitment. Although teaching includes a focus on students' emotional needs, expecting too much from teachers in this regard can be harmful for teachers' well-being. The literature also talks about emotional display rules. This is where you are expected to express a certain emotion like being calm and cool, even when you are actually frustrated with students or administrators. Hiding your own emotions too often can cause emotional labor, which can lead to negative work outcomes such as emotional exhaustion and burnout. As with all the professions, having an unmanageable workload can cause symptoms of stress at work. Finally, let's have a brief look at the research gaps. So of the 1 or 2 studies, half tested specific teacher well-being interventions. All of these interventions were at the individual level, like mindfulness practices, and some were also at the interpersonal level, like how teachers and students interact with each other. Interestingly, there were no studies of school level or policy interventions, even though researchers often recommend improvements to the school atmosphere and school environment. So more studies are needed there. Given the lack of studies outside of US, Canada, and Europe and Australia, our own case study is very important. Now I will turn it over to Dr. He.
Thank you, Sohail. So now I'm going to turn to the case study findings. So when we interview teachers, we first ask them to define well-being themselves, and then remember a time when they had strong well-being. We then asked all kinds of questions about that time, including what it felt like working with students then, what at the school helped them thrive, and were there any well-being programs? Across all 3 countries, there were 7 main themes that arose, like the first one here: teachers are valued and respected leaders. So using a cooking analogy, if you wanted to create feeling valued and respected for teachers, there are many ways to get there. And so here are some of the ways we heard repeatedly. I won't read through all these recipes for the sake of time, but just wanted to highlight a few, including parents asking teachers about the best ways to educate their children, or just getting support and attention from local community-based non-governmental organizations. The second theme we have here was teachers are deeply engaged in their work. We heard a lot about of teachers talk about the importance of continual opportunities for professional development and also involvement in substantive school decisions. Next slide, please. Another theme that arose was teachers get meaning and purpose from their work, where we heard a lot of teachers talk about the act and experience of helping other teachers and watching their students grow and succeed. Another theme that surfaced was teachers feel successful. For this theme, we heard many teachers talk about the importance of recognition by their principals and school leadership, or when the students succeeded and won awards. Next slide, please. We also found that it was important to meet the teachers' needs, not just in the schools and at work, but also in their home life, from personal needs to family needs. So policies rose to the surface here, unlike in the scoping review, and principals being flexible with teachers' workdays and their workloads was really important to teachers. And like in the scoping review, having the skills to manage your emotions and well-being was also important. And so many teachers mentioned wanting more work-life balance and even an atmosphere of maybe informal counseling between teachers. Next slide, please. Finally, we found that the work environment was extremely important. This included not having too much administrative work and really all parties of teachers, principals, and students supporting one another. Next slide, please. We also heard many teachers talk about this, a lot of this burdensome administrative work and how that may lead to burnout. Many teachers talked about how it felt lacking in meaning and possibly took up space for other work that was considered meaningful. Student misbehavior was also seen as a problem across all three sites, maybe around the whole world, but as well as difficulty juggling a heavy workload and finding some of that work-life balance. Many teachers that we heard from, particularly in Cambodia and Kenya, also talked about low pay and job insecurity. Next slide, please. Now, so while most findings were pretty similar, astonishingly, across each country, there were a few notable differences. So in Qatar, many teachers are actually not from Qatar, or expatriates. And, and so they often talked about missing their families back home. So that kind of led to wanting better and more flexible work leave policies that would allow them to travel home more often to reconnect with their families and communities. In Kenya, teachers talked about spending more meaningful social time with other teachers, and especially eating a hot meal at lunch or being invited to a principal's house. Those things are really meaningful in a Kenyan context. In Cambodia only, teachers frequently actually brought up their physical health concerns around teaching due to raising their voices, the chalk dust and marker fumes. And that was specific to Cambodia. Next slide, please. We asked teachers about well-being programs, and teachers were able to name very few. However, a few innovative ideas surfaced from the case study, which studies in the literature to date have largely not included. So in Kenya, teachers discussed this program that they called a merry-go-round program. In the merry-go-round, all teachers contributed money. And then when one teacher was in need, they gave that money to the teacher. In addition, they gave advice about how to use the money and met regularly to discuss how they were doing outside of the school setting. In Cambodia, one school's leadership raised funds from teachers, other staff, but as well as through entrepreneurial ways, such as renting out school spaces, parking lots, to vendors to sell food, drinks, and school supplies. And then all of that went into this school fund, which they were able to use to help teachers with unexpected expenses, such as covering hospital bills or family funerals. So these two examples point to caring for teachers' lives outside of work as well. We also heard about providing transportation and flexible hours to our teachers, as well as guidance counselors, not just for the students, but for teachers themselves. Perhaps more intuitive suggestions, but still things we've heard often and ideas that have not been in the literature. And then in terms of engagement, we thought this was interesting. One example we heard was of a teacher who was close to experiencing burnout, but then being invited to serve on the IT team across the school. And this actually added engagement, added engagement actually helped him, in his opinion, prevent burnout. We heard a similar example for a teacher who was asked to serve on a district-wide committee and how that also helped him experience less burnout or prevent it. Next slide, please. The case studies also revealed how just deeply embedded teachers are in relationships. It's such a relational work with principals, other teachers, students, and parents, and the degree of emotional work that comes with all these constant interactions. The interactions between separate actors influence the upstream and downstream interactions. So when principals praise teachers, teachers may be more likely to praise students. When students work hard, teachers may be more likely to work hard, as may principals. So based on a psychology-based construct called parallel process, this figure suggests that you can approach change from really any of these actors, from the principal, teacher, parent, or students. So I'm going to turn it over to Dr. Regine Pochette-Bell now to talk about some of these recommendations.
There we go. Hi, everyone. Yeah, so we wanted to try and be as practical as possible based on the findings from the case studies. So let me tell you about the case studies first. We distilled different recommendations by different actors. So here you see a slide for what we think principals can do. I'm going to cover this and one for teachers. If you want to reference the report or ask a question about it later, we also thought about what parents, policymakers, and the general public could do. And for principals, I just can't emphasize enough that praising teachers matters, as does getting to know them as individuals and trying to make things better for their individual situations at school, and also trying to make things better as teachers balance their needs at home. And there was just surprisingly little in the written literature about the home needs of teachers and bringing that together at school. But again, intuitively, it makes sense. And it arose very strongly in the 3 countries where we did these interviews. And I think it's just so important to realize, teachers got into teaching not to be a cog in the wheel or part of the machine, but because they connect with people and they connect with students. And so they want to be connected with as well. And so telling the teacher that you care about their well-being and wanting to know how they're doing just goes a long way. Now, how you care and convey support and care for teachers is really up to you. One thing I personally learned from this study is that when principals invited teachers over to their homes for, a social event, like teachers remembered this and they talked about it throughout their interviews. And so I personally have been trying to be a better supervisor and have people over to my house more often. I do see in the chat, someone asked what year we did this study. It was all in 2021, and it was definitely affected by COVID. And we can talk more about that in the Q&A if you want, but just to give it context. So for teachers, if I were a teacher, which I am not, and my hat is off to all teachers out there, including my mother and grandmother, who were like, the relationships and friendships that you have just cannot be understated. And even having one friendship, it's kind of like the students, right? Having one friend at school can make a big difference in your day. Well, it's the same for teachers. And the teachers with like the strongest well-being that we heard from, they felt like everybody at the school was working toward a common goal. And we did hear from some teachers that this was, scores, getting scores up at schools. But other times it was, focusing on the love and caring of each other at the school. And when people felt like the principals, teachers, students, and parents were all aligned, that was really the sweet spot of well-being. Let's see. Now, in the case studies, let me just hold up that idea of job crafting that Sohail spoke about is really important. If principals would give teachers flexibility, and then if teachers would think of like how they can make their day better, more meaningful, more enjoyable each and every day, that goes a long way. And I've studied burnout in medical providers and other people, and they do this job crafting thing as well, and it makes a big difference. We did not hear it in the case studies, but I do just want to hold up that if I were a teacher, I would consider doing some mindfulness-based stress reduction. We saw that a lot in the scoping review, and the outcomes from it are really good. All right, so combining these studies, what's different between them? What's similar between them? What does that tell us? So the case studies surface the well-being benefit of attending to the teacher's life beyond the school. So being flexible, offering financial support, having them over to your house, that kind of thing. The literature review showed that we need more studies at the school level, the organizational level, and the policy level. There we heard that the school atmosphere matters, but unfortunately there really aren't studies out there saying how to create atmospheres of well-being in school. Now, we heard some of that from Jennifer Adams, which is really helpful. So we need more practitioners and researchers coming together to study the atmosphere. And we also learned that we need more studies in low-income countries. And I've got to say, I think it was really important that we conducted research in Kenya and Cambodia. And from them, we heard quite strongly about the financial needs of teachers outside of the classroom and ways that communities support them. And in Cambodia, to give one more example, we heard real frustration from the teachers about their lack of technology and feeling like they were behind in computing resources and still using lesson plans for 20 years ago, and having an awareness that teachers in other parts of the world are creating lesson plans with the benefit of the internet and web-based resources, and then lacking those. And then just as a researcher who studies well-being, I have to say that it's fascinating to me, like what promotes well-being and what prevents burnout. When are they the same and when are they different? And so my imagination was captured by this idea that administrative burden is a problem. And so we heard throughout the study that removing administrative burden would prevent burnout. And what I pose to you all and wonder what you think as teachers and principals is that enough? Like, is reducing the administrative burden, will that by itself promote positive well-being, or does that just free up the space where it can occur, but you've got to do something positive as well? And so I think that'd be interesting to look into in the future. And then I just want to say that, I know a lot of our schools out there are under-resourced, and I'm all for more resources in the schools by a long shot. But there are some strategies that are free or lower cost, and I've highlighted them here in orange just to point that out. And with that, I will turn it back over to Dr. Baghdadi, or see if there are questions.
Thank you very much, Regine, Sohail, and he. This has been very interesting. I'd like to thank you for for leading that project. And I really enjoyed the time working with you all on this project. In fact, we have a number of questions. Some of them are about more about the design or the sample. So there is a question about, can you define more the teachers who were interviewed, or what grades they were teaching, what type of employment, etc. Also there's a question about whether the sample included some traumatized teachers who went through conflict or other issues.
Do you want to answer the questions about the sample?
Sure, yeah. So for the sampling, at each of the sites with our local collaborators, they helped us identify a list or a roster of I guess different types of schools. So first thing was looking at schools that were in the primary education. And then I think the second was secondary. So I don't know how that translates to different cultural contexts, but that's kind of the US version of it. We were looking for a diversity of teachers with different ranges of teaching experience, different genders, different subjects and so forth, but tried to be kind of inclusive of just all different types of teachers. But yeah, Regine, do you want to talk about the second piece with COVID? It's pretty traumatizing, and yet we had some limitations about conducting in COVID.
Yeah, we don't actually know. We didn't measure and ask if the teachers themselves had been traumatized. I can tell you that some of the schools where we interviewed teachers were very low-income schools, and we did hear about food scarcity sometimes. There's reason to believe that some of the teachers were working under real challenges and economic hardship, which can be different from trauma. And so I can't speak to that. We tried to recruit schools where they were really high performing, and that was so that we would know that teacher well-being, it just wasn't like teachers were being selfish. Not that this group would think that that would be the case, but that they were just taking care of themselves, and that therefore they had high well-being, but it was neglecting the students. No, these were schools that by and large were doing well by their students. In terms of COVID, we wanted to do the interviews in the fall of 2020. Well, you can imagine. So in different countries, schools were closing and opening back up again. But the teachers were mostly interviewed during the times that they actually were serving in the classroom. I think there were some interviews in Cambodia where when the schools had been shut down and they were interviewed by phone. But not most of them. Most of the interviews at the three different countries were in person in between shutdowns.
And just one more thing I think about the sample. We included teachers from private and public schools. So I think we, at least in Qatar, but also I think in Kenya and Cambodia, there were teachers from both types of schools. Just for diversity and to see if there are any differences. Thank you. I have another question here about the survey instruments, not for this project, but someone asked what survey instruments would you recommend for measuring staff well-being? In this case, teacher well-being, or maybe other or non-teaching staffs.
Ooh, that's a good question, and we might open it up to the expert group here. I can say for this study for burnout, we use the Oldenburg burnout inventory, which is free, publicly available online, and it gave us a sense of burnout. We also, to measure positive mental health and well-being, we used the Mental Health Continuum short form by Corey Keyes, and I'll put those in the chat, but I wonder if someone else has, people can, yes, please put them in the chat if you have your own ideas.
That's great, thank you. There's also a question about the rationale for selecting Kenya, Cambodia, and Qatar. Was there any specific reason for that?
So for us, it was partly convenience. Like we have the Center for Health Policy and Inequalities Research here at Duke has been working closely with ACE Africa Kenya, which is an incredible nonprofit, and they have an excellent research team, Cyrilla Amanya and others who are our partners here. And so we knew that this study was going to be very short in terms of how much time we had to carry it out. So we went to where we already had good colleagues. So that also includes in Cambodia, the development for Cambodian children, or DCC, led by Van Rothvan, again, like a 15-year collaboration. And then thanks to WISE being both a funder and a true research partner in this, like Ahmed Baghdadi and Miriam Al-Khalaf and others were really key to us.
Thank you. We have a question about specifically about Qatar, and I can help actually answer that. But the question is, did the culture play a role in Qatar in terms of interventions needed, other than the fact that teachers who are expatriates wanting more flexible breaks, etc.? Yeah, I think in my view, the flexibility in breaks would be great, but also emergency breaks are important. And sometimes teachers who leave their families behind and move to Qatar to teach, they sometimes have to go home for emergency situations during the school year, and that is a challenge for them. And it's I think for them it would be an issue if someone is sick back home, or someone is going through a difficult time and they can't be there. But there are also other things, like when the teachers bring their families over to Qatar. Teachers with large families, I think, sometimes find it difficult to cover the housing expenses of their families, and they have to rent a large house, and sometimes the packages, the expatriate packages that are offered to all expatriate teachers in Qatar, sometimes are not enough to cover large houses. So that's something that might not be an issue for some teachers, but it's definitely an issue for others. And maybe in Kenya and Cambodia, this is not a problem, since there might not be any expatriate teachers, but there are teachers from maybe other parts of the country commuting to schools, or maybe just moving from one city to another. There's another question here about if there's a link between the philosophy of pedagogy, accountability, and well-being. This might not have been the focus of the study, but feel free if you could share your reactions to that, Regine.
I think I need to turn that over to someone else. I don't know if Jennifer Adams would want to answer that, or somebody else.
Sorry, Regine, exactly on what part?
The question is, yeah, let me say the question again. Have you found links between the philosophy of pedagogy, accountability, and well-being?
Absolutely, absolutely. And I think that's such a good point. When we, in my work that I've done, when we started to really work on pedagogical practices in the classrooms, we opened up instruction. We had more relationships between students taking charge of their learning and teachers kind of facilitating that. It had a huge impact on student engagement with learning. And as a result, better feeling of well-being for the teachers. The teachers could see that the students were engaged. There was a better ambiance in the classroom. And as a result, teachers reported that they had better well-being because they could sense it in their students. So there's a huge piece there. The other comment, Regine and Ahmed, is on the relationship to accountability. Where in the global work that I've done, where there are systems that have, I'm going to call an overemphasis on large-scale assessment, where it's punitive and used for rankings, etc., it has a negative impact on teacher well-being. So we really have to be thinking about, it's not about getting away from large-scale measures to be seeing how our education systems are functioning. We have to be really careful about how we use that information and make sure that we're using it to provide resources to schools and to teachers, as opposed to punishing the teachers or the schools.
That's very interesting. Thank you. One more question here, basically about comparing the countries. So someone is asking if there are any reflections comparing Kenya and Cambodia, especially when they have similar characteristics in terms of either conflict or neighboring countries with issues such as Myanmar crisis, etc. And if you found any interesting comparisons between Kenya, Cambodia from one side and Qatar from another side.
Would you like to take that, or do you just want me to talk off the cuff? You know, one thing that I was really struck by was how similar our findings were across the three countries. So we held up just that one slide with a few differences. We really did look for differences, although we have the most confidence in the findings that are similar because we heard them repeatedly. And it's possible that if we heard, you know, like we heard about physical health in Cambodia being important to the teachers, and we didn't hear that anywhere else, but we also didn't ask it anywhere else. So perhaps if we'd asked it of the teachers in Kenya, maybe they would have said, oh yes, that was really important. And while 90 interviews is a lot for an in-depth interview study, I mean, the amount of transcripts that we made it through in just 4 or 5 months was a lot. It doesn't give me a lot of confidence in what the differences were. I did have a sense in Cambodia that people didn't, I had wondered, you know, from my US perspective, if there would be more talk about kind of meditation, and there was, I do think there were more words on kind of like love, friendship, kindness. I think we heard a little bit more about that, but it wasn't even as striking as I had kind of hypothesized it might be. Again, in Kenya, I think maybe we heard from some of the poorest schools, and that really stood out to me, like the struggles of teachers, getting transportation, losing transportation, not like the real hardship of income lost if a family member died and trying to get that funeral covered, the true the genuine gratitude toward principals who were understanding if they miss work, or the value of having lunch. I think some of that probably spoke to economic differences. I don't think we heard about conflict in neighboring areas.
Yeah,
thank you.
I can just add to that too, that part of the study design that we had was that we specifically chose 3 geographically, culturally distinct and diverse places, and then paid most attention to the things that were similar across them, so that these key findings were more robust. And I think oftentimes in our global work, in our international kind of settings, we do see a lot of these blanket policies that come from just a study of one region, of one culturally, geographically distinct setting, and then being it, you know, kind of spread a blanket policy across the world where there may be some settings that it just doesn't apply to. So that was just part of our study design, and very intentional that we did that.
Great. I think we have room for one final question, and this question is about how principals promoted teacher well-being in schools. If you could share some examples. And I think I can share an example from Qatar, is that some school principals actually brought lunch to teachers every now and then, you know, at school. That would be, you know, fun time. Some actually invited schools over to, you know, the principal's farm or house for a social gathering. I think that made a difference for the teachers in Qatar. Now, but you could share examples from Kenya and Cambodia as well.
I remember, I'll tell one and then maybe he, if you remember one, but I remember there were a couple stories where teachers felt like parents were coming after them, were really upset with them for not doing well by their children. And when the principal supported the teacher, I mean, that bought them lifelong gratitude from the teacher, and it made a big difference.
That was the one
That's
I was
great.
going to say too.
Wonderful. I think this was very interesting, and we have a lot more in the report. And I would like to invite everyone here to download the copy of the report. It's available on the WISE website, and there's also a link to it on the Wellbeing Project website. The report and the executive summary are available in both Arabic and English for Arabic speakers if they're interested. Again, thank you so much, Regine, Sohail, and He, for the presentation and answering the questions. I really enjoyed it. And I hope everyone has found some insights that they can, apply at work and implement in, as teachers or principals or school leaders. Now, I would like before we move to the last part of this event, I would like to ask everyone to stretch for 1 minute only. You can just stand up, grab some water, but not go away. It's not a break. It's just a 1 minute stretch so we can ensure the well-being of all attendees and speakers and participants, since we talk well-being. And we'll just pause for a few seconds and then come back to move to our panel. All right. Now, I'm so pleased and honored to introduce my colleague, Dominic Register, a program director at Salzburg Global Seminar, who will moderate this panel. And I'm looking forward. We have a wonderful lineup of speakers here. Dominic, feel free to jump in. The floor is yours.
Thank you very much, Dr. Ahmed. What a fantastic presentation and keynote that was. There's so much to think about and reflect on from the first hour of this session, and really grateful and appreciative of the opportunity to be part of this panel discussion now. So we have about 50 minutes for the panel discussion. We have an amazing lineup of contributors and guest speakers. So you can see them there on the screen. They have a kind of fantastic breadth of collective intelligence and experience to bring to this topic. And the way that we're going to structure our time together is I will ask each of them to introduce themselves and also to reflect a little bit in their opening remarks on where they think responsibility for teacher well-being lies, because I think that's, there seems to be a really powerful consensus across the case studies, from the literature review, from so many of the comments and contributions in the chat below, that this is a really important topic, that teachers are fundamental to so many different aspects of our future prosperity, our future capacity to flourish and thrive as a species in what is shaping up to be a more and more challenging century than anyone could have predicted 20 years ago or even a decade ago. And teachers have such a critical role to play in shaping the values and experience and capacity to contribute of future leaders, who will resonate through different generations. But when we think about, so there is consensus around that and the importance of the role of teachers. But when we think about where specific responsibility lies for shaping policies that will promote teacher well-being, there seems to be less consensus around that. So I'm going to ask each of the panelists to briefly introduce themselves and their work, and then share an opening thought about where responsibility lies. And we'll then move in to a general conversation. We'll have about 30 to 40 minutes for that, and we'll then bring in as many questions from the chat as possible. So please continue to share links and reflections and thoughts in the chat on Zoom. And as I said, we'll try and address as many of them as possible. So I wonder, Manuela, if I could begin with you, and then we'll go to Zarmina, and then John, and then Chelsea. But Manuela, to you first, please, and welcome to the stage.
Thank you, and thank you, everyone. It's great to be here and to have followed the really interesting presentation from the speakers before. I'm a policy analyst, an education policy analyst at the OECD. I've worked on a number of different countries, and I've just recently been involved in a review of well-being policies in the private sector in Dubai. So I'm coming at this from that angle of the policy side. So to answer the question, Dominic, obviously responsibility lies everywhere. I think it's fair to say that it lies with each and every one of us who's involved somehow with the school community and with the education sector. But given my experience and given my position, I think I can focus a little bit more on the responsibility that lies with policymakers, that lies at the central and national level of government, also the regional level of government. And there are a couple of reasons why I think it's important that we mention this first, and I'm glad I'm the first one speaking for that reason. But mostly because I think it can be quite easy for us talking about well-being sometimes to forget that level, to forget the fundamental basic rights that need to be in place, the basic conditions that need to be in place for teachers, for staff to thrive and to be able to work and be successful in their jobs. I think sometimes we tend to focus on the micro level and on what individuals can do themselves. And obviously that is very important, but we mustn't forget that governments need to be there providing those basic conditions. Obviously, I'm thinking a lot of the Ministry of Education or whatever similar body exists in the different countries, but there is a lot to say also of other levels of government and other government bodies, from the Labor Ministry, ensuring that people have adequate working contracts and basic working rights, to, for example, colleagues were mentioning the case of Qatar, and I was working with the Dubai case, where there are people coming in from so many other countries. So you have to ensure that there are decent and correct, adequate conditions for people who are coming from different countries. And there are so many other policy tools that there are in place for governments to ensure teachers' basic conditions, from building a rewarding and attractive teacher career to data collection, to strategies to ensure that teachers are valued and respected. So maybe I'll stop here.
Thank you for that really clear answer. I wonder if I could ask you a very quick follow-up question. That with the work that you do and the kind of survey opportunity and responsibility you have, are there specific systems that you've looked at that have strong policies in place? You've kind of been really clear about responsibility being with policymakers and with the Ministries of Education or Ministry of Labour. And I wondered if there were any compelling examples that you could briefly shine a light on.
I think it's a bit hard to answer your question, as it always is, but to pick up on what colleagues said before, it's a new topic. So it's a bit hard to know what policies at the system level have been effective at supporting teacher well-being. But there are obviously countries that have got the basics of building an attractive teaching career as a whole. Obviously, countries like Finland, for example, or Estonia, are some examples that come to mind, but sorry, I am a bit unable to answer it fully.
That's great, and obviously resonates with some of the 7 principles in the research around the conditions that create underlying well-being. So brilliant. Thank you very much, Manuela. We'll be back to you momentarily. Samina, I'd love to bring you onto the stage now, if that's okay.
Sure. Thank you, Dominique. I have been a teacher and administrator for the last 22 years. And I worked in Washington, D.C. with overage and undercredited kids, and they were probably the most vulnerable youth in the district. And then I'm now here in Qatar as a principal in one of the Qatar Foundation schools. It's a boarding military leadership academy. So I work daily with teachers and students in very high stress school environments. And wellness has to be and had to be part of how we do business in our school culture to create a safe school environment. And so our priorities shifted as a school after the pandemic, and our focus was on health and wellness, engagement, and then academics. And so we actively put systems in place to support the teachers in real time in place. And that means in the school during the school day. So the school took active responsibility and accountability for that. And we no longer look at it as a private matter that teachers have to take responsibility for their own well-being. And I do want to say, as an administrator who does a lot of networking with administrators in DC and in Qatar, there are certain reasons for the pushback of why administrators might not feel that this is necessarily their responsibility in schools. And when I talk about administrators in schools, I'm looking at the principal or the director or the head of school. And one of the reasons is that this seems like a very personal space, and a lot of administrators might not feel comfortable having these conversations and staff meetings about health and wellness, eating well, exercising. And the second reason is that many administrators come with a background of educational leadership, maybe pedagogy, teaching and learning, curriculum. They might not necessarily feel that this is an area of expertise for them. And it feels like a high stakes area in terms of creating a nurturing and safe environment. And the question of, could I possibly harm the well-being of one of the teachers that I work with and that I supervise if I don't get this right? And so I think that these are, and while I completely and utterly believe that the teacher well-being is the responsibility of the school, especially the administration in the school, I understand why there is that pushback from some administrators in schools. So I just wanted to share that.
Well, thank you. And I know I know I've had the chance to speak to you before, but your perspective at this particular moment in time is so important, I think, because you've worked in different systems at different points in the pandemic, but been able to prioritize well-being and wellness in the different institutions that you've led. And interesting different take to Manuela's, that you're seeing responsibility perhaps primarily with school leaders and policymakers. So we're starting to build up this kind of holistic approach to where that lies. The other thing I just wanted to reflect on really quickly based on what you said is, when you talked about pushback or opposition from some administrators, really interesting how that dovetails with some of the opposition to social and emotional learning as an educational reform that we're hearing in some countries, that this is straying beyond the responsibility of the school or the teacher and encroaching on people's personal lives.
Absolutely. And I'm old enough to remember 20 years ago, when we were having these conversations and we were at the fork in the road when it came to student well-being, and many teachers feeling, this is not my area of expertise. I don't feel comfortable. This is sort of a personal space of a child. And I am a chemistry teacher. I'm a biology teacher. My role is not to support, the wellness of students. And we've moved away from that, and we've been able to create systems. And I think that you won't find a scholarly opinion that says, no, of course, student well-being is not your responsibility. No teacher or scholar or educational scholar would ever say that. And I feel we're in that same situation now currently with teacher well-being, really at that fork in the road. And I'm hopeful that we'll move the way we did with student well-being, we'll move towards that, everyone in the building, especially administrators, are accountable, and it is not a private matter that a teacher has to take on their own in their home, but it's systems and policies and that are put in place in the school, again, in real time during the school day.
It's a fantastic point, and reinforces the timeliness of this piece of research, that it's the right research arriving at this time, because these conversations are beginning in multiple systems, and this provides a lot of the evidence to support and underpin those. So thank you, Zarmeena, for those opening remarks. We'll be back to you in a moment. And John, I'd love to turn to you now and bring you onto the stage. Welcome.
Thanks, Dominic. Hi, everybody. Welcome. It's a joy to be in your company. My name is John Gasco. I'm from Dallas, Texas in the United States, and I am the Chief Wellbeing Officer of a large public school district. We are an international baccalaureate school district for all. In our region, we have about 47 schools serving about 26,000 students. And so well-being is really anchored in our vision, the IB vision in particular, like creating well-rounded, whole students and scholars capable of exercising agency and change in the world is first and foremost rooted in a sense of well-being. So that's what we are about. And so my role is not only to help ensure that we are in fact supporting student well-being, but we're also doing that for staff, because as we've heard today, and not only in the report, but seen in the sort of rich remarks in the chat, I'll harken back to a quote many of you probably have heard from Lao Tzu. It says, "The care for the teacher is to love the learner." And so if we don't pay attention to creating the conditions to where our educators can thrive in the midst of their work with young people, then there'll always be an imbalance. And so in terms of locating, responsibility, I would just sort of like to share like the sort of nature of the global condition that we're getting in. Like the future is already here. We have these heightened fragilities that we're all grappling with. Some across the world have called it a meta crisis, from increasing scope, frequency, and scale of disruption to human displacement to rapidly rising and uncharacteristic disease and pandemics, the rise of anxiety and depression among young people as a new normal, the fragility of our support systems, the balkanization and familiar loss of democratic structures and processes, climate change, war and conflict, wage stagnation. I mean, the list goes on, and these factors are sort of compressing against each other and colliding in such a powerful way that this meta crisis locates first and foremost the question of well-being, I think primarily in the individual's agency. And so we're not only talking about how to survive and thrive in an education system which in and of itself is turbulent and complex and challenging, but if you think about the nature of the meta crisis that we're all facing, we have to individually prepare ourselves through active well-being strategies that will allow us to find balance in the midst of extraordinary motion and adversity. Secondly, I would say, because in terms of the well-being journey, the best that we can do primarily, whether as leaders or support networks, is to invite people on the journey. But fundamentally, people have to walk through that gate and actually do things about their well-being. And so therefore, I err and lean on the side of, if you provide people with a well-being vision that provides choice and scope and range that is responsive to their culture, their different demographic characteristics, then we have an opportunity to all collectively win. Secondly, I think in education systems, one of the sort of root microsystems within any given school system or school is the nature of human resources and human capital, or people teams. And in fact, we have I'll speak from a US perspective, very antiquated, outdated notions of what human resources means in this current and future climate that we're all dealing with. And so I think we have to locate some responsibility in being wildly imaginative about what is the role of a human resources unit or team or staff or system within a school system, to really not only think about it as, oh, these are the benefits you get and you can sign up here, and if you have any problems, we're going to refer you to the appropriate person at, whatever particular benefit plan you're signed up for. So we need to create obviously good, inviting, supportive benefits for people, but we also need to reimagine what is a proactive, responsive human capital approach to well-being in the midst of that, so that we're providing people with a much deeper platform of benefits. And then third, as has already been alluded to, principals, school leaders are the drivers of change. And as Zarmina alluded to, sometimes leaders don't feel equipped with the sort of mental models and skill sets, but it doesn't take very much to create some actionable leadership moves to invite colleagues in any given school on a journey of well-being, as part and parcel of supporting them. And so I would say individual agency, reimagining human capital systems and what supports they offer, both proactively and responsibly, and then really reimagining leadership preparation and ongoing support so that school leaders know how to guide and provide resources and strategies will get us further on our way.
Fantastic. Thank you, John. I particularly appreciate the reference to mental models towards the end. And, one of the things which is potentially unique about being human is the capacity to rethink the situations that we find ourselves in, and that you don't need to choose between two less good options. You can think of new mental models or create new mental models to completely reframe the possibilities. I wondered if in your in the schools that you work with, you've seen examples of school leaders or principals being able to bring those new kinds of mental model to bear.
Absolutely. One is, the easiest way to create change, in my experience, is to make the change you desire part and parcel of the way in which you culture leadership. So, for example, one move that we've done is the way in which school leaders begin and close meetings across the network begins first in conversations and check-ins around how people are doing from a well-being perspective. And so we don't just immediately jump into looking at Algebra 1 cut points at meetings, however important those are, but really creating a container or a space, a collective field within which people can be vulnerable, and that's not easy. And so we culture the beginning and end of every meeting in our network from a well-being perspective, and you could extend that kind of move in a variety of ways. School leaders also are doing well-being town halls where they will provide, hospitality. It's akin to what was named earlier about the principal hosting for dinner, but in this case, or a meal, but the principal hosting a town hall where delicious food and beverage is curated, teachers feel welcomed, and they're given a creative way to express, what's going on. And so very simple moves. The key is you just got to do it. Creating that culture of well-being that can begin in individual meetings and can then seep through and inform or infuse to the rest of the school. Thank you so much, John. We'll be coming back to you shortly. Chelsea, I'd love to welcome you to the stage. Thank you so much for being with us today.
Thank you. I'm swimming with ideas. I feel like I want to respond to everything I've heard in the last hour, but I'll try not to. I'm Chelsea Prox. I am a former teacher. I felt pretty pushed out of two different really significant teaching experiences because of my well-being. So in one instance, the same week that I went to the hospital with a stress condition was the week that I decided not to return to a school. And in a second instance, I went months and months and months with cycles of bronchitis and needing to be out and struggling with substitutes. And ultimately, I just couldn't balance being well and taking care and loving so many other young people. So I left the classroom and got a master's in public health. And I work hard at the American Federation of Teachers to try to address school health and make schools a space where people don't have to make the choice that I did or have the experience that I did. In that role, I do policy and programs and practices, and maybe that will be relevant later, but I want to tackle Dominic's question of sort of what is the responsibility? How do we get here? And one of the things that I love about the research report, and especially one of the graphics that I saw, was that there were 5 different stakeholder groups that were identified, and they were all identified as mutually reciprocal, that there isn't a single place to begin, there isn't a single right answer, that there's great work that can really begin anywhere. And because of my perch in a national teachers union in the United States, I want to highlight one of the pathways by which I think some of those groups come together and some of these right answers get strung together. So we're seeing right now, for example, individual educators, teachers and school counselors and occupational therapists and paraprofessionals and bus drivers are seizing their individual agency. They are coming together for collective action. They don't want to have one-on-one conversations with principals or one-on-one conversations with parents per se. They want to have a serious and significant impact on their material conditions, their working conditions, their students' learning conditions, and they want to do that together. And they also understand that they don't necessarily get to make every decision. They don't get to, control every single resource. And so that collective action has multiple policy targets. They are sometimes focused on connecting with their superintendents, and sometimes with their school boards, and sometimes with their state boards of education. That collective action can take the shape of the very famous strike, which is actually very rare in a labor context. It can also be committees. It can also be, conducting surveys and making sure that everyone's working from the same data set. But I wanted to name sort of those 3 components to marry some of what I'm hearing from Zarmina and from John and from Manuela, that when I see educators being, in John's words, wildly imaginative, a lot of what they come to is that they have to be together to address whether it is basic working conditions, as Manuela held up, or changing some of the really basic policy, or to do some of the way more freedom dreaming that I hear that Zarmina has been at the helm of in some of the school systems that she's worked in. Either way, we really find that educators find they need to band together to make those things real. So I'm sure there'll be opportunities to say more, but I'd love to pass it back to you, Dominic.
Thank you. I also was really struck with that graphic, I think, where it was teachers at the center, wasn't it? And then it was parents, policymakers, students and principals, I think, and there was the kind of interconnection between them, and that sense that if you can positively influence one group, then it has a kind of knock-on effect. And so I think, for all of you, what you've all been saying, that the report is coming at the right time. There is increasing interest in this topic. We're moving towards a kind of greater appreciation of a culture of well-being. I think it was Sean Slade had put something in the chat about, the idea of one of the few positives to come out of the pandemic is this kind of assertion of the principle of Maslow before Bloom, that people are thinking about their essential needs first and foremost. I would love, Chelsea, because you're working at a system level, to get initial thoughts from you about where you see the kind of most, the greatest opportunity for levers for change, and what are the, which are the open doors, as it were, that we could be pushing at to start driving this through.
I feel like this is a really hard question. The wish list is so long, and to put one at the top feels challenging. I feel like I'm going to give an answer, and then everyone after me, I'm going to go, oh, that's what I should have said, right? So the first thing that comes to mind, especially in the United States context, is to acknowledge that schools are the pediatric mental health facility of this country. More students receive mental health services at school than receive them from any other institution or type of care provider. And that makes schools a fundamentally public health institution. And educators that I talk to will be the first to tell you, just because we're doing more of it doesn't mean that we're satisfied with what we're accomplishing so far. We know that our young people deserve more and better. And I think in the United States, we are seeing attention to how bad things are, right? We're paying attention to emergency room visits and, as John said, rising rates of depression and anxiety. We're noticing that widespread bereavement because of the pandemic really has significant impacts on well-being. And I think we're seeing a really widespread, therefore, commitment to doing something about it. And there are a lot of right answers to what can be done, but being honest about the role of schools in that answer and being honest about the institutional commitment necessary to be serious that schools are a public health institution, I'm going to put as my number one.
That, to John's point about new mental models, that is a kind of really powerful reframing around a kind of post-pandemic purpose of school, I think, and something that I'm sure will provoke a lot of questions and comments in the chat. So thank you for that. To open it up to the other panelists, to John, Samina, and Manuela, where would you target effort initially? Which do you see as the kind of the most promising levers for change, or the best opportunities for bringing about this kind of transformation now?
I would say, looking at the day-to-day operations, I think so many administrators control the day-to-day time and schedule of teachers. And we did something radical in our school. Was we have 30 half day that is allotted to all of the schools. And that half day is designed for students go home, and a lot of that time is used for deliverables such as curriculum or aligning curriculum, grades, meetings, creating professional learning communities. And a lot of this time is controlled by administrators. And so what we did was we looked at those 30 days. We decided to look at all of the different professional development things we needed to do. We prioritized them, and out of the 30, we cut 15 out. And so we looked at quality over quantity, and normally would take, teachers would have 6 days to, for example, align their curriculum. They only had 3. The other 3 days, they could do whatever they wanted. And again, health and wellness, engagement, academics. There was no need to have a teacher sit through curriculum alignment meetings. If they haven't slept all night, they can go home and take a nap during that time. And so in so many businesses, project management is controlled by the individual, but in schools, it's not. Administrators control so much of that time. And so to give that time back to teachers, and there's always that fear of, oh, but things won't get done. But in a lot of project management, things do get done. When the individual, the teacher has their own time, they can use it as they want. Maybe they don't want to work on curriculum alignment from 2 to 3, and they want to work on it in the evening, and they want to go home and take a nap after teaching 3 classes. They're exhausted. So I think that looking at time and day-to-day operations and getting teacher feedback and input into that is really critical. And we saw a difference in that when we changed how, again, we did business.
Was your experience typical in that you had the autonomy to be able to make those kinds of changes, or was that a decision that, sort of seek forgiveness rather than permission approach to bringing about the culture that you wanted?
Was initially seek forgiveness before permission, but right. When it went well and we were still productive, things, deliverables that needed to be given to the district or the charter board were ready, and we were able to do what needed to be done, nobody questioned, and teachers were happy at the end.
And so it had a kind of ripple effect on Absolutely. Other schools in the area.
Absolutely, absolutely.
And Manuela or John, I'd love to get your thoughts on the kind of open doors, or the kind of the buttons to push to build the momentum to drive this kind of change.
I was just gonna build on what Samina said there, because I think one of the things I heard from what she said, but it's something that we know also from the research, is the importance of flexibility overall for teachers. And it's not just the flexibility of being able to use the time as they want, but also to begin focusing more on certain areas, developing more, etc. So I really do agree with everything Samina said, obviously everything Chelsea had said before, but just to follow up on that. I think another lever for change that actually policymakers have and schools have, is to really go out there and survey teachers, asking teachers what is happening with them, what are their needs. And this information can be very valuable to build those responses. This might be very different from country to country and from school to school and from district to district. And you won't know this until you ask and until you hear the reality of those teachers on the ground.
That's brilliant, thank you. And I think we will talk a little bit about context in a minute, but John, just to bring you in quickly, if there's anything you'd like to add.
I really appreciate what Manuela just said about like asking matters. We run a measure of staff well-being and culture anchored in the Gallup 12 survey here in the US. And Gallup, the Gallup organization has actually added well-being measures to their 12 questions. And so we do the Gallup 15 now with 3 actual well-being questions built into the culture survey. But the key, I think, harkening back to what Manuela said, is if you ask, then you have to do something in response to what they say. And so you can ask their feedback and opinion on how culture is going and what the level of morale and climate is, but you have to, as a leader, be held accountable for bringing that data back in front of people, making sure you clarify and tweak and understand the feedback and how people are doing, and then create or co-create even better a responsive strategy to how you are going to address it. So you, just like if you look at student data on any given academic indicator and you seek to move from one state to the next in terms of progress, you have to approach well-being and culture the exact same way. And so reminding school leaders that they've got this, and teachers that they've got this incredible skill set that's data informed and data driven. The difference is turning that skill set on a different kind of data really matters. And then the second thing I would just say again is, you know, the nature of our benefits for teachers. As Armina talked about, time is one way to give back. And we've experimented with that, but I mean, healthcare benefits, for example, in America for teachers are so outrageously expensive. People can barely sign up for them and afford them. And they actually have a disincentive to use their health plans because the cost just to get primary care set up on a regular basis makes it exorbitant. And so really pushing legislative leaders to look at sort of very simple like approaches to like healthcare, for example, for teachers and how that subsidizes and supports them could go a long way. What we find in America generally, and in Dallas, is that about 50%, believe it or not, I don't have an empirical report to support this, but it shows up time and time again in my own experience. If you ask teachers how many of them just get an annual physical from their doctors and do something about it, only about 50% are getting an annual physical. That's true for our network. And so if we're not even like paying attention to our baseline vitality indicators, then, you know, we're going to really continue.
I agree completely. And that kind of segues nicely, I think, into the next thing I would love to talk with you all about. So we sort of talked a bit about different ideas about where responsibility might lie. We've talked about some of the open doors or kind of potential easy wins or levers for change that exist. The next sort of obvious set of questions is, how do you incentivize this kind of change in creating this sort of culture? And I would love to get your thoughts on that, about what you think compelling incentives might be for policymakers to bring about the policies that we need, for more school principals to do the kinds of things that Zalmina talked about in her experience, for more teachers to do the kinds of things that John was talking about with individual responsibility. So yeah, ideas about the right kinds of incentives that, you know, because I think all of us who are part of this webinar live, or will be watching it on demand, or who read the report, will be interested in advocacy in some capacity around this topic. And what can we collectively do to create this kind of culture? So what would you see as the right incentives to start lobbying for or introducing?
Maybe I can
Yes.
get started, and like Chelsea said, I'll start with the basics, and everyone else will say something incredible after me. But I think one thing is just doing exactly what the report has done, of putting it out there as putting out there the message that teacher well-being is important, and it's important for teachers, it's important for students, it's important for the entire education system. I think the minute people are aware of the importance of this, they're much more willing to add it into their own responsibility and to be committed to this agenda. So maybe something very basic, but I think without it, we just, there are no other incentives that can do as much.
It's using the evidence base that the reporters.
Research has shown that teacher well-being is important for teachers. It's important for students. It's important, therefore, for the parents, for the economic development of the country, etc., etc.
Yeah.
If we don't do anything about it,
and I think
there's a risk.
To reference one of another OECD publication, but there's such compelling evidence from the study on social and emotional skills that connects well-being with academic attainment, for example, that it's moving into that, it's not just the right thing to do, it's also the smart thing to be doing, to be prioritizing this, because it has multiple benefits.
Absolutely. And I think most countries and most education stakeholders have this understanding when it comes to students and student well-being. I don't think we're there yet with teachers and teacher well-being and the performance of education system yet, but there is evidence suggesting that all these elements are linked, like the report
and it's taken a lot of time for the student well-being to rise up the policy agenda, and there are now compelling case studies from a wide variety of different systems that reinforce this. John, Samina, or Chelsea, any other ideas about incentives that need to be brought to bear or highlighted or introduced that would help bring about this kind of shift or culture?
So I think there are two items that I would add to Manuela's suggestion of just raising awareness. I see in the United States, unfortunately, after a lot of things take a crisis inflection point. That we see so many people fleeing a particular job category, or just catastrophically terrible outcomes in a particular state, or with a particular group of students, and that level of, oh goodness, what a bad outcome, forces attention to the root causes. And so often what we find in education is that educators are not happy about their working conditions, and that there's something that really needs to fundamentally change in order to make these sustainable roles that people will stay in. In the US, at least, we don't find that we're not preparing enough people. We don't find that we don't have educators or students going into teacher prep programs, for example. We find that once they become teachers, they don't stay teachers. And so there's something to be said there for what's happening in that first 3 to 5 years that drives so many people away from the profession. On a maybe less disheartening note, I think to connect to some of the things that I've seen a lot of energy around in the chat, and back to this question of ask educators, and yes, be aware, but I think there are certain data sets that potentially clarify root causes better than others. I want to add to the long list of suggestions already, the Professional Quality of Life Assessment, or the ProQual. It's available for free. It's a validated instrument. It was designed for people who are in caring and nurturing roles, which can include nursing, it can include teaching, it can include lots of different things. It's 30 questions that look at compassion satisfaction as well as compassion fatigue. So really seeking to be honest about the idea that showing up in a place that requires deep human relationships can either be super fulfilling, or it can be really difficult at the end of the day. And it can be both for the same person. Those 30 questions can be used every 30 days. And we have worked with some school districts to use it to get sort of a baseline before they implement a program, to see where is your workforce, how are they feeling right now, and can we focus on eliminating burnout, for example, or improving compassion satisfaction as two complementary sides of the same challenge.
Brilliant, thank you, and thank you for sharing the link in the chat as well. One of the things which is really striking about the research report, I think, is how consistent the 7 principles underlying teacher wellbeing were across the different case studies. And it feels like there are, these are almost universal things that are true, for everyone working in a professional context. It may not be specifically limited to teachers, but they are fairly universal. And so I'd love to just get your thoughts on contextualization, and how much you think well-being policies need to be culturally contextualized, or does this report and other work that you've all referenced actually give us a kind of blueprint for a universal approach to teacher well-being, that it is about school culture, it's something which is in the power of individual teachers, of principals, of systems to be able to implement fairly quickly, and then it's a question of political will to drive the individual and political will to drive that kind of change? Or do you think that actually the kind of cultural factor needs to be understood more deeply, and that well-being in one context, manifestations of well-being in one context will be different to others?
Hey, Dominic, I would just add very simply, I think there are some approaches generally that we can take culturally across the board to remind people how valuable they are and how much their health and well-being matters. However, just to give some context in Dallas, in my work, I do find that when you use the word like wellness or well-being, it's very loaded culturally, and it strikes people in different ways. You have many people, for example, from different communities who have grown up, and the notion of wellness and well-being has simply not been accessible. And so if you start introducing it, you have to pay careful attention to how people perceive it, interpret it. You have some cultures who historically have been preyed upon by health systems and been experimented on. And when you start saying, hey, we want to now vulnerably start digging into this topic of well-being, it strikes a chord of suspicion. And then also there are like taboos in some communities about the notion of mental health care, like signing up and raising your hand to say, it's okay to raise my hand and say I need help is very difficult. And so culturally, sort of taking a proper accounting of how different like cultures and people like, are going to perceive the work and or the kinds of vehicles to provide invitation. So what we've done is created racial affinity groups around the topic. And so we regularly bring people together in a voluntary way where they caucus by racial groups or other groups. And actually within those groups, that caucusing, they talk about perception and create definitional notions of what well-being might mean to them. And we take that information and then start to look at what are some common themes across the groups that would create maybe some easy wins on the board. And then what are some more complex areas that would require us to be much more intentional about.
Thank you, John. Some really thoughtful remarks about not just, about understanding the context. Any other, Manuela, Zamina, Chelsea? Otherwise, I'm going to, oh, great, you've both done
Yeah. Oh, sorry, Chelsea, go ahead.
Okay, thank you, Manuela. I'll try to go fast. I would like to hear from you as well. So in addition to what I heard John say, I want to highlight 3 different reasons that I think being really intentional about identifying the target of any well-being programming requires specificity. It could be cultural specificity. It might be national specificity. I think we have to always pay attention to marginalization and who is oppressed in any given space. And that shifts because those are folks who are more vulnerable. And if we really want to be honest about improving outcomes, we also have to be honest about how risk is distributed. I think one of the things that I saw in the presentation on the sort of low-hanging fruit and low-cost options stuck out to me. It was prayer. in many, many United States schools, prayer is not an option for a school leader to lead, to guide or to ask for or to encourage people to participate in. That's a very culturally specific, there are laws that separate church and state. So in public schools in particular, that is not a good solution in the US for the most part. And then I want to underline as well that I've heard a lot today about social support, and especially the way that school leadership is potentially offering social support to teachers through praise, for example, making sure that people get information and advice, making sure that people get time and resources. Those are 3 different types of social support. And social support is as effective as the person receiving it believes it to be. So for example, I use this one a lot. When my husband offers me advice, I don't necessarily receive it as supportive. When my friends offer me advice, I might receive it really differently. It's not necessarily the intention of the person delivering it, it's the reception. So again, paying attention to your audience and how they might receive different programming is really important.
Thank you, Chelsea. Manuela, you were going to come in.
I really agree with everything John and Chelsea mentioned, but just to say it's also not just a matter of contextualizing the response, but also understanding the differences in the issues. Is it stress, and where is the stress coming from? I mean, all of these elements might be incredibly different from country to country, from school to school. In one, it might be that parents are creating a lot of pressure and teachers are having to handle that. In others, it might just be that teachers have to, deal with violence and there aren't enough material resources, etc. If you don't understand what's happening, it can be, just say, it's very important to understand what is happening behind those things and respond accordingly. So a degree of contextualization is very important.
Thank you.
I just wanted to add here that this is really important in terms of putting systems and interventions and accommodations in place, because just as an administrator who went from DC and we created, what I thought was an incredible wellness program for our teachers, I could not cut and paste that model and use it here in Qatar. I mean, we had to start from scratch and, evaluate the community, what works best, what's important to them, what is a priority. And so I think that that's really important, that you just cannot cut and paste a model because it's successful somewhere else, because I think that's more detrimental to a school community, it's with all the great intention, but I think it's much more detrimental. So I think we have to be very careful as school administrators to not do that.
That's excellent point from all of you. Although the sort of 7 principles might be universal, the route to realizing those principles is going to be very context specific and culturally different. We're almost at time. What I would love to close out with is ask each of you for thoughts as to where you would like the research to go next, or what do you think are the next frontiers in this? And then we're going to hand back to Dr. Ahmed. So Chelsea, could I pass to you first? Is that okay?
Sure, thank you. I didn't see the name in the chat, or it didn't stick with me, but I will elevate what someone else said, that I think the capacity and willingness of educators, teachers in particular, to think of themselves as leaders and to explore what a teacher leader or teacher leadership role can entail. What are the boundaries of it? What can be tucked into it without it becoming too big of a burgeoning role? I think that's a really great research question that I don't know the answer to. And I'd love to hear what that is, especially across different cultural and national contexts.
Thank you. And thank you for using the platform to elevate someone else's voice. Zarmina, perhaps we come to you next.
I think to understand budget and money and financial sustainability and responsibility around wellness, there's not a lot out there. I think it's very difficult for school leaders to try to implement and make wellness a priority when there are no conversations around what is the cost of this. And I think that that needs to be a greater, conversation around cost and what is considered financially responsible in terms of wellness.
Great, thank you very much, Zarmina. John, come to you next, please.
Yeah, I think, we need to really be smart in providing leaders with roadmaps, on-ramps, models of how to do the work, anchored in research. So some of the findings from this report, for example, while it comes across on face value somewhat generalized, let's take like the emotional labor of teachers, for example. Like, how does a school leader truly begin to get on the balcony and look at the work from the perspective of emotional labor and start creating ways to alleviate some of those pressure points? And that is a difficult skill, and so again, I think really creating practical follow-up solutions that give school leaders easy wins to begin talking about the importance of this and begin actualizing strategies would be my recommendation as an important next step.
Thank you. Manuela.
Yeah, just coming back to something that I saw in the report, I think one of the important next steps for research is to really be able to start assessing the impact of system level policies. But also, if possible, to start disentangling all the different factors to be able to understand what is the effect of what's the impact of a school versus what is individual to a teacher, and how do all these elements come together.
Thank you. Regine, Soel, Dr. Ahmed, I hope you were taking notes as you've started something really significant with this piece of research. Thank you ever so much to the four of you, to Manuela Fitzpatrick, John Casco, Zarmina Hotaki, and Chelsea Prax for sharing your insights and giving time to this really important topic. And thank you to everyone in the audience for answering one another's questions and for sharing resources and helping to build a really compelling session. So Dr. Ahmed, can I hand back to you, please?
Thank you so much, Dominic. And I can't really say anything beyond what you've said. We had a wonderful discussion. We have so many questions that have been already answered in the chat. We have a lot of resources here to share. We'll be very happy to also share the recording and the slides shortly for everyone to have access to those. And I would like to encourage everyone also to go to our website or the Wellbeing Project's website and download the report. You can, use it, refer to it. Feel free to send us questions. I think you have our contact information. So we're very pleased to see a lot of interaction, a lot of discussions and importance of teacher well-being. And this is the main reason why we put this together. We wanted to highlight how important it is to take care of our teachers. We wanted to make sure that everyone plays their role in promoting teacher well-being, sustaining teacher well-being, ensuring that our teachers are happy or motivated. We want to attract more people to the teaching profession rather than losing teachers who are stressed. So with that, I think it's we come to the end of this session. I would like to thank everyone who contributed, all the speakers, panelists, and the team here, and as well as all the attendees. I hope you've all enjoyed the event and now have some ideas or can think of the how to improve the situation for the teachers in your schools. On behalf of the Wellbeing Project, Duke University, and everyone, I wish you all the best and looking forward to seeing you all in the next event. Thank you.